Mental health problems are a major part of our workload, and unfortunately in this part of the world, at these economic times and for all sorts of reasons, we have an increasing workload relating to mental health.
The types of people I see with mental health problems are really people that come to me for other things, such as women's health, such as management of chronic disease, but also have an issue with mental health.
When I'm on reception, I am the first contact somebody with mental health has. We don't have an appointment sometimes to assess whether they can wait today or whether they need to be seen straight away.
It is difficult for some people to use the practice well when their mental health is not so good, and we don't always consider that as much as we would like to. If somebody is having a struggle to get an appointment or perhaps can't express themselves, without being prejudicial in one's thoughts, it's important to think, does this person have needs that I've not identified?
The aim of the project is to raise awareness for mental health within primary care, and it's something that I'm really quite passionate about.
One of the biggest factors in this project is that the actual training is being delivered by people with a lived experience of mental illness.
So what I'm going to do today is talk a little bit about the project, tell you about my experience of primary care. As a service user, I feel I can speak with authority because I'm actually telling my own story. Believe it or not, 6 years ago I was a head teacher in a primary school. And like many people who do a very stressful job, I thought I was Superman and that I was managing perfectly well and that I was doing really well. But deep down I wasn't. And that was me, 22 years teaching, no job, big mortgage, 5 kids to support, in a mess and really not well at all.
A lot of times the GP surgery staff have got this misconception that people with mental illnesses are always ill. They cannot communicate, they cannot speak, and they cannot function normally. So this is kind of like busting that myth.
If it's 1 in 4, then we're talking about their colleagues and the people that they work with. So it's not just the people coming into the doctors, it's everybody who works there and their families at home.
And never discussed my mental health. And in fact, my GP didn't know I suffered from a mental health issue. But on the 4th visit, I actually brought it up. I mentioned it. And she was noticeably alarmed. And what alarmed me was that the next time I went to see my GP for a physical condition, she actually kept the door to the consultation room opened where previously it had been closed. So this worried me, and I did go back one more time, and again she kept the door open. And this just led me not to trust my GP. It changed the relationship between my GP and myself.
And just with a few small adjustments, it can be such a better episode for them. And it has such an influence on people. If they get treated right straight away, it can make such a big difference to their recovery.
I think it's very useful having a patient being so open and honest about their mental health history. As nurses, because we're so focused on what the patient comes to us for, we don't always get a chance to talk to them about their mental health issues. And it's nice to have some of that from a patient in a live sort of setting.
Yeah, the training, certainly we were very keen that it was for all members of the team. We very much want people to be aware. I think they can often realise they can make a contribution as well, and if the atmosphere in the practice is universally accommodating and understanding, then it's likely the outcomes for the patients will be better. And interestingly, it's also likely to be less stressful for the staff who sometimes have difficulties if they can take a step back and think, perhaps I can understand more about why this person is behaving as they are, or demonstrating a certain sort of emotion that I might understand better.
This training session is only the beginning. It is only opening the door to a whole wide world out there of further resources, further information, further a lot more other things that people can do to help and support people who live with mental illnesses.
It's that one-to-one interaction between people and that opportunity to start becoming more aware and more open about talking about people's mental health.